Good morning, everyone. Thank you for joining us for the Dental Board of California Quarterly Board Meeting. I am Dr. Alan.
This meeting is being recorded.
I'll start again. I'm sorry. Good morning, everyone. Thank you for joining us for the Dental Board of California Quarterly Meeting. I am Dr. Alan Felsenfeld and serve as the president of the board. Today is Thursday, February 10th, 2022. This board meeting is being held via WebEx. In accordance with Government Code Section 11133 and Governor Gavin Newsom's Executive Order N-1-22, this meeting will be held by teleconference with no physical locations. For all those who wish to participate, please log in to the website provided on the posted agenda for this meeting. Instructions to connect to the meeting are provided on the agenda. The preferred audio connection is via telephone conference and not the microphone and speakers on your computer. The phone number and access code will be provided as part of your connection to the meeting. Since this meeting is being conducted by WebEx, I will ask all board members and speakers to announce themselves by name before speaking for clarity of the official record. All board members are able to unmute themselves to speak during the meeting. Please place yourself back on mute when not speaking to reduce background noise for all participants. When making a motion, please use the raised hand feature to be called upon and then verbally state your motion or second so staff can identify the motion and second for the meeting record. During a discussion on an agenda item, please use the raised hand feature if you wish to speak, and I will call on you. Following such online media etiquette will ensure the best audio quality for everyone, that all comments can be accommodated and are heard before proceeding with the agenda. This is an official business meeting of the Dental Board of California. The Dental Board welcomes public comments on any item on the agenda, and it is the board's intent to ask for public comments on the topic under discussion prior to the board taking any action on the items. The DCA moderator will explain the process for providing public comment shortly. When called upon, the moderator will give the individual permission to unmute themselves, and they will have 2 minutes to make public comment. The moderator will audibly announce when 30 seconds remain to conclude the public comment. After the 2 minutes have lapsed, the individual will be placed back on mute. Only one public comment per agenda item is allowed per attendee. Depending on the number of people who would like to testify on a particular agenda item, a total time limit may be imposed. We ask all speakers to please stay on topic and not repeat testimony already provided. If you agree with the testimony already provided, please just state your name and that you are in support of any comments previously provided. I would now like to ask the DCA moderator to please explain how public comments will be taken during this WebEx meeting.
Thank you. This is the moderator. To facilitate public comment today, we will be utilizing the WebEx question and answer feature. You will hear me refer to it as the Q&A. When the board reaches a point in the agenda at which public comment is appropriate, the Q&A feature will be turned on, and members of the public can indicate that they would like to make a comment by inserting the phrase, "I would like to make a comment," or simply the word "comment" into the question box. This box will be typically located in the right bottom corner of your screen and can be accessed by clicking on the Q&A icon, which looks like a question mark inside of a square. Then you will submit that request to our panelists. Please note that this Q&A feature is being used only as a means for members of the public to represent that they would like to make a verbal comment. This is not a means to ask questions of myself or members of the board. Such inquiries submitted using this feature will not be answered. When making your comment, please make sure the comment is directed at the host in the drop-down. For those members of the public who have called into the meeting, you may utilize the hand raise feature to indicate you would like to make a comment by dialing *3. We do ask that once you have made your comment, you dial *3 again to lower your hand. I will call on the first individual to request for comment, as we will take them in the order that they are received, and I will give that individual permission to unmute their own microphone. When I tell you that I've sent a request to unmute your microphone, you should see a pop-up at your end with a blue button that says unmute me. You will need to click that button to unmute your microphone. Each individual will have 2 minutes to make their comments, and at the conclusion of the 2 minutes, I will be muting your microphone, moving on to the next member of the public. I will be providing a 30-second warning before your time does expire. While you are free to express criticism or negative views, for the sake of the members of the public participating on the call, please do not use profane language when making public comments to the board. I will provide a brief reminder of this approach at the start of each public comment item. And finally, when board members or senior staff are not speaking, I would like to remind them to mute their microphone. If I detect background noise during the meeting as a result of unmuted microphones, I will either interject with a brief friendly reminder or simply mute your microphone for you. And with that, I will turn it back over to Dr. Felsenfeld.
Thank you, moderator. I would like to call the meeting to order and ask the board secretary to please call the roll. Dr. Molina?
Dr. Molina, I see you're unmuted, but I do not, we cannot hear you. Now we can.
Okay. Sorry. This is Dr. Sonia Molina, Board Secretary, and I will now call the roll. Chang?
Chan, here.
Chang present. Felsenfeld?
Felsenfeld here.
Felsenfeld present. Lorraine?
Lorraine here.
Lorraine present. Mackenzie?
Mackenzie here.
Mackenzie present. Medina?
Medina here.
Medina present. Mendoza?
Mendoza here.
Mendoza present. Molina present. Montel?
Montel present.
Montel present. Morrow?
Morrow present.
Morrow present. Olagi?
Olagi present.
Olagi present. Pacheco?
Pacheco present.
Pacheco present. And you?
You present.
You present. We have a quorum.
Thank you, Dr. Molina. We will now move on to agenda item number 2, public comment on items not on the agenda. As we move into the public comment period of items not on the agenda, please note that in accordance with Government Code Section 11452.10, Subdivision A4, the board, as the adjudicator in administrative discipline cases, cannot take public comment on pending disciplinary matters. Accordingly, if an individual makes comments on a pending disciplinary matter, the individual's microphone will be muted. Of course, if the public comment raises concerns with the statutes under the Dental Practice Act, the board may choose to discuss those items at a future board meeting. As always, the board will not respond directly to any questions asked during the public comment period. Are there any public comments? DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've opened that Q&A panel. If you'd like to request to make a comment on items not on today's agenda, please find that Q&A icon, typically located in the bottom right corner of your screen. Access that text box and type the word comment into the box, submitting that to our panelists or myself. If you're a calling user, you can dial *3 to raise your hand. I'm not seeing any requests for comment. Would you like me to close the panel?
Please do.
It is closed.
Thank you. Now we will move on to agenda item number 3, discussion and possible action on the November 18-19, 2021 board meeting minutes. Is there any board member discussion on the minutes? Please use the raised hand feature. I see none at this time. Is there a
Member
motion?
Pacheco? Member Pacheco has her hand raised.
I'm sorry, I don't see her here. Okay, Ms. Pacheco.
Yes, this is Board Member Pacheco. I have a couple of corrections on page 3 of the meeting minutes. Paragraph 5, it has listed board members, and then it has the first name, Dr. Lilia Laren. Should it then read Dr. Stephen Morrow, Dr. James Yu, Dr. Alicia Montel, and Ms. Rosalinda Olagi?
We see that that's an editorial comment. I think that can be taken care of very easily by staff. Thank you.
Yes, on page 18, last paragraph, it's Dr. Heidi Linser, not Dr. Heider Linser.
Again, thank you. Staff will make that correction for you.
And then on page 20, the very last paragraph, the board received public comments. It is Dr. David Waldschmidt. And that's the end of my comments. Thank you.
Thank you again, Ms. Pacheco. Staff will make all of those corrections. They are appropriate. Is there any other board member discussion? I see none in my list. In that case, is there a motion to accept and a second? Please use the raised hand feature to be called upon and then verbally state your motion or second.
This is Medina, motion to accept.
Medina, motion to accept the minutes. Is there a second? I'm not seeing, moderator, I'm not seeing raised hand features on my screen here. Am I missing something? Because I'd like to be able to do that and not prolong the meeting by.
So if you next to on your participant panel,
Right,
that should be open on the right side of your screen. Do you have that open?
I do.
So next to the search bar, there's arrows that give you a sort feature. You can sort by raised hands, and it should put anybody with a raised hand to the top of your list.
In general, that'll be fine. Thank you. I still don't see any raised hands unless, let's see, no. I see 3 in that box, but I don't see any 3 raised hands. Is it, I see myself, you, and Ms. Taryn, who I don't think would be making a comment at this point. So
I can help with the raised hands if that's helpful.
I am not seeing any right here. So please, if I can see them, fine. If not, you're going to have to help me with that. Thank you.
I will help you. And
So we're
Tara
still
Welch
looking for
does
a
have a
second.
hand raised.
Who
You
does?
second. You second.
Thank you, Dr. Yu. The motion is to accept the minutes of the November 18th and 19th meeting. I believe those are the dates. Are there any public comments? DC,
I'm
DC
sorry,
moderator?
Dr. Felsenfeld, Tara
Yes.
Welch has her hand raised. She may have a comment to make.
Okay, that'll be fine. Thank you, Ms. Welch. And I'm terribly sorry not being able to see this. It says sort by them, but it's not doing anything. So go ahead, Ms. Welch.
Hello, Tara Welch, Board Counsel. I just wanted to explain Ms. Pacheco's request for edits on page 3 to add the board member first names in the list. The way the meeting minutes are detailed is the first mention of a board member uses the full name, and then subsequent mentions of that same board member only uses the official title with the last name. So if I just wanted to correct that confusion there. So we may not be making any edits to page 3 because, you know, for example, Dr. Morrow has already been mentioned on page 2. So we would not use his first name in subsequent references. Thank you.
Thank you, Ms. Welch. Ms. Pacheco, do you have that? You understand that?
I do.
Okay.
The only other correction is Rosalinda Olagi is Ms. Rosalinda Olagi and not Dr. at this time.
I don't think that was an issue. We have a style, is what Ms. Welch was telling us. So let's continue. Do we have any other board member comment on the minutes?
Dr. Yu has his hand raised.
Go ahead, Dr. Yu. Oh, I do see them now, moderator. Okay, Dr. Yu, go ahead. Did you have something to say?
Oh, no, I forgot to lower down my hand.
That'll be fine. Thank you very much. And Ms. Montel. Dr. Montel, excuse me, Dr. Montel.
Thank you. I just wanted to make sure actually that you could see my hand because I didn't think you could see it before. So if you can see my hand, then we're good.
My new glasses are working just fine now. Thank you very much. Dr. Chan, did you have something you wanted to say?
No, this is Chan. I see how the hands are raised, and so when the hand has the slash through it, it's the hand down.
That part I don't know. I guess you hit it again and it goes away, as I recall. Moderator, can you help Dr. Chan for a moment?
It says lower hand now.
I can see it now. So if you click it again, it will go away. There you go.
Okay, our logistics seem to be in control. We have our style working on the minutes. Are there any public comments? DCA moderator, would you please facilitate the lines for public comment?
This is the moderator. We've opened that Q&A panel. If you'd like to make a comment on the motion before you, please click on that Q&A icon, typing the word comment into the text box and submitting that. Or for calling users, you may raise your hand by dialing *3. And seeing no requests, would you like me to close the panel?
Yes, please.
It is closed.
All right, thank you. Board Secretary, please call the roll and record the votes for this agenda item.
The motion is to accept the minutes for November 18th through the 19th, 2021. I will now call the roll. Chang,
Chan, aye.
Chan, I, Fessenfeld,
Felsenfeld, aye.
Fessenfeld, I, Larin,
Laureen, aye.
Larin, I, Mackenzie,
Mackenzie, yes.
Mackenzie, I, Medina,
Medina, aye.
Medina, I, Mendoza,
Mendoza, I.
Mendoza, I, Molina, I, Montel,
Montel, aye.
Montel, I, Morrow,
Morrow, I.
Morrow, I, Olagi,
Olagi, aye.
Olagi, I, Pacheco,
Pacheco, I.
Pacheco, I, and you,
UI.
I. Motion passed.
Thank you, Madam Secretary. We will now move on to item 4, Board President Report. Well, that's my report. I have been president of the board for just shy of 6 weeks. Normally, this report covers a 3-month interval, and one would not expect that much would be going on, but there have been things that have kept me busy. On January 22nd, I attended the Dental Hygiene of California Board quarterly meeting, and on January 28th, I attended the Dental Assisting Council meeting to get a sense of their pertinent issues. Dr. Yu and I attended the Department of Consumer Affairs orientation on January 25th with presidents and vice presidents of most of the many agencies within the purview of DCA. We received information on how the department functions and the interactions between it and our boards. Next week, we'll be attending an orientation for the new presidents of boards by the Department of Consumer Affairs. On a weekly basis, I meet with Sarah Wallace, our interim executive officer, for discussions on issues before the board, and I'm becoming well-oriented on the day-to-day processes of our board, as well as our interactions with outside organizations. This has been an incredibly educational experience, and I look forward to continuing these meetings. My only regret is that I had to decide to make this meeting virtual, despite the ability to have face-to-face meetings at the time we made the decision. While it was a possibility, and I strongly would like to see this coming back, I believe that in the overall interest of safety for all in this WebEx, the most practical way to conduct our business at this time would be by the WebEx. I very much look forward to meeting in person in the future so that we can continue to develop the camaraderie and personal interactions that will only add to our proficiency in doing the work of the board. And that is all I have to report at this time. Are there any board member comments? Please use the raised hand feature. And I think I've got that under control now. I see none. Are there any public comments? DCA moderator, please facilitate the lines for public comment.
This is the moderator. Our Q&A panel is open. If you'd like to comment on the president's report, use that Q&A panel. To submit your request for comment or for calling users, you can raise your hand by dialing *3. And seeing none, would you like me to close the panel?
Yes, thank you.
It is closed.
We will now move on to agenda item 5, the interim executive officer report. I'm going to ask Sarah Wallace, our interim executive officer, to present this agenda item. Ms. Wallace.
Good morning. This is Sarah Wallace, interim executive officer. It's been an eventful last 6 weeks. On December 30th, Karen Fisher, the board's executive officer, officially retired, and I began my responsibilities on December 31st. As Dr. Felsenfeld reported, we meet on a weekly basis, sometimes more, and I've enjoyed our conversation. To start with, I'm going to provide a personnel update. There are currently 22 vacant positions with the board. Previously, Karen has reported on the vacancy rate. We have been continuing our recruitment efforts, and we are in the stages of making final hiring decisions. For each unit, we have one vacancy in the executive management team, which is the permanent executive officer position that is currently being recruited. In the administrative unit, I'm pleased to report that we just hired David Bruggeman as the new legislative and regulatory specialist. He started on February 1st and has quickly jumped into his role here at the board. We currently have the budget and contract analyst position vacant in that unit, and we are actively recruiting to fill behind that position. In our licensing and examination unit, we still have 5 vacancies, but we're nearing final hiring for several of the positions. The unit manager is still vacant. We are reviewing applications and will be scheduling interviews over the next few weeks. The lead AGPA in that unit is in the final hiring phases, and we expect that position to start in the next 2 to 3 weeks. The 2 staff services analyst positions are also in the final hiring phase, and we also expect those to be hired in the next few weeks. And the program technician position is currently being advertised. In the dental assisting unit, there are 7 vacancies. The manager is currently being advertised. The 2 AGPA education consultants are in the process of having applications reviewed, as well as a staff services analyst. Applications are being reviewed and interviews will be scheduled. The MST and the office assistant are being scheduled for interviews, and an office assistant is also being screened. Applications are being screened. In the anesthesia unit, we have 2 vacancies. The staff services analyst is in the final hiring phase, and the AGPA legislative and regulatory analyst is moving into a continuous recruitment until we're able to find a qualified candidate to fit that position. In the complaint and compliance unit, we currently have 1 AGPA vacancy that is being advertised. In our investigative analysis unit, we currently have a manager position. Daniel Rangel, who was a supervising special investigator 1, departed in the middle of January for a promotional opportunity at Bureau of Private Post-Secondary. We're very pleased for him. And it'll be difficult to fill behind him. We are still working to hire the Inspector 2 position in that unit, and I'm pleased to report that we did hire 2 new special investigators, Stanley Peterson and John Barkley, who joined the team in January. Our discipline coordination unit is fully staffed. In our Sacramento Enforcement Field Office, we are still recruiting for an Inspector 2 position. And in Orange, we are still advertising for 2 sworn investigators. Denise Meehan, who was a sworn investigator, just retired last week. She had over 16 years of experience with the dental board, and she'll be sorely missed. And the last vacancy is the Inspector 2 that we're working with HR on how to fill that appropriately. We've been aggressively recruiting and interviewing candidates to fill these vacancies, and the board is offering in-person as well as telephone interviews as optional interviewing methods. And I'm hopeful that we'll be filling these vacancies within the next 2 months. Next, I have an update on the Director of Department of Consumer Affairs waiver orders and the Governor's executive orders. On January 5th, Governor Gavin Newsom signed an executive order which extended the sunset of AB 361. And under this order, state bodies are permitted to continue holding public meetings via teleconference through March 31st of 2022. This executive order allowed us to meet via teleconference today. On January 11th, the Director of Department of Consumer Affairs signed 2 orders extending the waivers relating to individuals seeking to reactivate or restore a license originally issued by the board. A license reactivated or restored pursuant to this waiver is valid now until April 1st of 2022 or until the state of emergency ceases to exist, whichever is sooner. The next order that was extended was the waiver relating to internet-based continuing education training for dental professionals. The director extended that order on internet-based continuing education training for dental professionals and that order now terminates on March 31st, 2022. This information is available on the board's website under our COVID-19 link, which can be viewed at the top of the homepage. Next, an update on the board's strategic plan. The board adopted its strategic plan at the last meeting in November. Our action planning begins next week with Solid facilitating a manager's meeting to work through the action planning steps, and I intend to report back at a future meeting on what our findings are. An update on COVID-19 vaccination and testing requirements. In July of 2021, Governor Gavin Newsom announced that the state of California was taking action to combat the spread of COVID-19 by implementing a first-in-the-nation standard to require all state workers to either show proof of full vaccination or be tested for COVID-19 at least once per week when working on site. In response to these requirements, the department, in coordination with CalHR and Department of Public Health, developed a testing program to serve the department, its entities, and its employees. Dental board employees began testing on October 28th and continue to be tested weekly on Thursdays from 8 a.m. to 12 p.m. Test kits, supplies, and program technology are provided by the state's testing vendor, Color. Additionally, and I'm sure Brianna Miller will be addressing this, board members are also required to be tested if proof of vaccination is not provided in order to attend board meetings. And we will be collecting that information and coordinating the necessary testing arrangements prior to board meetings moving forward. At the last board meeting in November, the board had requested the submission of an executive officer salary level increase. At this time, I continue to work with HR, and I expect additional information will be forthcoming at a future meeting. As a reminder, the Form 700 Statement of Economic Interest is due by April 1st. The reporting period for this form is January 1st, 2021 through December 31st of 2021. Email notices were sent to board members at the beginning of January, and I've been sending reminder emails. The department has asked that these forms be submitted by March 18th to ensure compliance. I'm pleased to report that we only have a few members left that need to file, and I thank you all for getting those forms in as quickly as possible. For those that still need to file, please make every effort to complete and file the information as soon as possible. Additionally, since this meeting was held in early February, the notice of the agenda was right at the cutoff for introduction of two-year bills. And I have a brief update. On January 31st, Assembly Bill 1733 was introduced. This appears to be AB 885 resurrected and is intended to allow the board to continue to meet via teleconference and makes amendments to the Bagley-Keene Open Meetings Act. At this point, this bill will most likely be on an agenda at a future meeting for the board's discussion, and this would be a valuable resource for the dental board and our meetings moving forward. And with that, I'd be happy to answer any questions.
Thank you, Ms. Wallace. Are there any board member questions or comments? Please use the raised hand feature. I see Dr. Morrow.
Thank you very much. Thank you, Ms. Wallace, for your comprehensive report. Question that I have regarding the current number of vacancies, 22 as I understand. Is this fairly normal for operations, or is this an excessive number of vacancies and staff? And if it is unusual, do you have any ideas or concerns regarding what has brought about this number of vacancies?
Thank you, Dr. Morrow. It is a high vacancy rate. For several of the positions, we've had difficulty finding qualified candidates, and so we've had to continue recruiting. For the most part, those involve the Associate Governmental Program Analyst positions. It's difficult to find folks that are actually qualified to perform the functions that the board needs to do. We have had various situations in which we've made formal job offers and we've gotten all the way to the start date and a hire will back out. I've had discussions with the budget office regarding this. This seems to be a theme statewide. I don't think that this is necessarily unique to the dental board. While we still see 22 vacancies, while it is still a high vacancy rate, it's an ever-changing population that's in the vacancies. So it's not the same positions that we're recruiting for at any given time. People take promotional opportunities, they take lateral transfers, they're looking for opportunities with the COVID restrictions to move on. So at this point, we are working closely with HR to improve our recruitment strategies, improve our advertisements and the qualifications that we're looking for to narrow down the applicant pool to the most qualified. We're evaluating telework capabilities for the positions that can work via telework, and we're continue to hire as quickly as possible.
Okay, thank you very much for that comprehensive explanation.
Are there any other board member comments? Please raise the hand and we will call on you. I am seeing none. Are there any public comments? DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've opened that Q&A panel. If you'd like to comment on anything in the interim executive officer's report, use that Q&A icon to access the comment box. Submit the word comment to myself or our panelists. And for our call-in users, you can raise your hand by pressing *3. Our first comment comes from a call-in user sending a request to unmute your microphone. As a reminder, you'll have 2 minutes and you'll want to wait just a moment for the recording to stop playing. I see that you are unmuted. Okay, to our calling user, we cannot hear you at this time. I'm going to mute your microphone and send you a new request to unmute. You should see a blue unmute me button. I see you're unmuted now.
Good morning.
Good morning, thank you.
My name is Michael Commenator, and the purpose of my call is to inquire about how the complaint department handles complaints, and has there been any improvement since the last 10 years where they've got a *1 rating on Yelp, Reddit, other social medias?
May I suggest that that's maybe a little bit off topic. We're looking at the report of the interim executive officer right now, and if that's a very specific complaint, you can possibly write into us and someone will look at your concerns.
And with that, Dr. Felsenfeld, I don't see any additional requests. I will close the panel.
Thank you very much. We will now move on to agenda item number 6, the report on from the Department of Consumer Affairs and their activities. I will ask Brianna Miller from the DCA Office of Board and Bureau Relations to provide this report. Ms. Miller, good morning.
Good morning. Can everyone hear me just fine?
We can.
Great, thank you. I was over here troubleshooting my headphones and hoping they weren't going to go out on me. So hopefully
that kind of morning.
That is, yes. Well, thank you for having me today. I will say in advance that some of what I have to offer, it will mirror what Ms. Wallace just shared, but hopefully it's all valuable information that you don't mind hearing in duplicate nonetheless. So with that, I'll get started. So good morning, board members. I'm Brianna Miller with the Department of Consumer Affairs Board and Bureau Relations. Thank you for allowing me an opportunity to provide a department update to your board today. And first, I want to start out by saying Happy New Year and thank you. DCA appreciates all board members and staff who have continued to serve through a pandemic that has affected all of us in so many ways. California and DCA have continued to adhere to health and safety mandates to protect employees, consumers, and our communities from the spread of COVID-19. State employees must show proof of vaccination or be subject to regular COVID-19 testing when working or meeting on site. DCA's testing program has expanded to include additional sites, home testing for qualified employees, and voluntary testing for fully vaccinated employees. As California moves past the recent Omicron surge and into a new endemic reality, a new state public health order will lift universal masking for vaccinated individuals beginning February 16th. Unvaccinated individuals must still wear face coverings in all indoor settings, and in some high-risk settings, such as healthcare facilities, face coverings will be required for everyone regardless of vaccination status. Local orders may be more restrictive to respond to community conditions, so please be aware of changing public health guidance and remember that as state representatives, we are all expected to adhere to state and local orders while carrying out our duties. Moving on to an update on remote meetings. As Ms. Wallace mentioned, on January 5th, Governor Newsom signed an executive order that extends the sunset date in Assembly Bill 361, allowing boards and committees to meet remotely without listing board member locations through March 31st. DCA and its boards and bureaus have recognized the benefits of remote meeting options, including greater public participation, reduced costs from travel, and the ability for members and the public to participate when in-person meetings might be unsafe due to COVID-19 circulation or exposure. I'm happy to let you know that on January 31st, Assemblymember Quirk introduced new legislation, AB 1733, which would permanently allow board and committees to meet remotely while also providing both virtual and physical options for members of the public to participate. If this bill is passed by the legislature and signed by the governor, it would take place immediately. Next, a note about vaccination verification for in-person meetings. Since we cannot be certain that AB 1733 will be enacted or when, boards need to prepare for the possibility of in-person meetings after March 31st. And if AB 1733 is enacted, many boards may also choose to hold one or more meetings in person to allow members to connect and to complete business, such as strategic planning, that may be more effective face-to-face. Before attending any in-person meeting, members must verify full vaccination with DCA's Office of Human Resources or participate in COVID-19 testing. If any members have not yet done so, please submit your proof of vaccination. Your participation will assist DCA in planning for testing at future meetings. So to that, we request that you please do this as soon as possible, and please don't hesitate to reach out if you need assistance. And I want to express my appreciation for the flexibility of board members, staff, and the public as we have all navigated this changing pandemic together. And I'm optimistic about the future and look forward to seeing you all in person one day. Next, I'd like to address board appointments and recruitment. Whether meeting remote or in person, DCA wants to help keep your board fully seated with excellent members and diverse voices. Currently, the board has 3 vacancies, 2 public members appointed by the governor and the Senate Rules Committee, and a licensed member appointed by the governor. DCA's communications team recently released a new communications toolkit to assist boards with member recruitment, and it's available in multiple languages. Board members can also encourage individuals who are interested in an appointment to visit the Board Member Resources Center, which is accessed via DCA's webpage, to apply for an appointment. And next, a tongue twister for me. It'll be an update on DCA's Enlightened Licensing Process, or project rather. The Enlightened Licensing Project is a work group that was formed to utilize licensing subject matter experts within the entire DCA. This group will help individual boards and bureaus streamline and make their licensing processes more effective and efficient by utilizing best practices information technology, and cost-saving measures. Their first deep dive, which was done for the Board of Registered Nursing, has completed, and a report will be released in the near future with recommendations that can be used by all boards and bureaus to improve their processes. After a successful first round, the work group will move on to another board or bureau. And next, I'd like to introduce DCA's new Compliance and Equity Officer. As DCA looks to the future, Director Kirkmeyer continues to lead the department toward a continual improvement and excellent service. DCA is pleased to announce that Tanya Corcoran has been selected to serve as the department's first Compliance and Equity Officer, effective March 2nd. Ms. Corcoran brings invaluable expertise, insight, and years of hands-on experiences with DCA's boards and bureaus to this new position, most recently having served as Chief Deputy Registrar at the Contractor State License Board. As a special advisor, the Compliance and Equity Officer will provide leadership and policy direction related to quality improvement measures such as performance assessment, quality assurance, incident management, risk management, and regulatory compliance. This position will also oversee DCA's solid training and planning solutions, the Organizational Improvement Office, Equal Employment Opportunity Office, and the DCA Internal Audits Office. Bringing these offices together under Ms. Corcoran's experienced leadership will be a tremendous benefit, allowing DCA to better identify and analyze emerging issues department-wide and provide timely solutions to our divisions, boards, and bureaus. And finally, a reminder about required board member trainings in Form 700. And that reminder is that board members have training and paperwork requirements. As Ms. Wallace mentioned this, each year, board members are required by law to file a Form 700 before April 1st or face penalties from the FPPC. DCA requests that you file as soon as possible, and as a tip, I'll let you know the best way to avoid my reminder phone calls and emails is to file early. If anyone needs assistance, DCA's filing officer and legal counsel are available to help. And as for training, board members who are recently appointed or reappointed need to attend the board member orientation training within a year of that appointment date. You can register for the BMOT through the Learning Management System, or LMS, which is DCA's training portal. Live virtual trainings will be held March 9th, June 15th, and October 12th. This is a required training for newly appointed and reappointed members, but we also encourage it for any member who seeks a refresher. Board and Bureau Relations is happy to assist you with any questions you may have about BMOT or the use of LMS. And as always, Board and Bureau Relations is here to help your board. So if there's anything we can do to assist you, please do not hesitate to reach out. And that concludes my presentation. I'll hand it back to you, Board President Felsenfeld. Thank you.
Okay. Thank you, Ms. Miller. We appreciate your comments. Are there any board member comments? Please use the raised hand feature. I am seeing none at this time. Wait, Dr. Morrow.
Thank you very much for your report, Ms. Miller. Well, I was disappointed, as I'm sure with other board members, that we were not able to have a face-to-face meeting for this time. However, I do want to express my appreciation for the department's concern for all of our safety, and I am looking forward to a face-to-face meeting with a number of board members, new board members that I have not really been able to make face-to-face contact with. So appreciate your concern regarding our safety, disappointed as I'm sure others are, and looking forward to a future face-to-face meeting.
Thank you.
Thank you, Dr. Morrow. Is there any other comment from the board members? Are there any other comments, I should say? Dr. Morrow, you have another one? You want to put your hand down? Which is it?
Sorry, I have a hand stuck.
Okay, thank you, sir. Appreciate it. Any other board member comments? Seeing none, are there any public comments? DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've opened that Q&A panel. As a reminder, this is for comments on the presentation by Ms. Miller. If you'd like to make a comment regarding items mentioned in her presentation, please use that Q&A panel to submit your request for comment. For call-in users, you may raise your hand by dialing *3. We do have a request from our calling user. I've sent a request to unmute your microphone. I see that you are unmuted.
Yes, good morning. This is the party that called in a few minutes ago requesting information on transparency with the complaint department. Since I was cut off, I'd like it to be added to one of the meetings where is one of the agenda topics to be addressed.
Okay, thank you, sir. That's not on topic with the item we're discussing. I would request that you submit your request via email to the board. Thank you. And seeing no additional requests, I will close the panel.
Thank you, DCA moderator. We will now move on to agenda item number 7, the budget report. I'm going to ask the representatives from the DCA budget office to present this agenda item, and please identify yourselves as you speak.
One moment as I get them promoted.
Good morning. This is Bill Lloyd from the Budget Office.
Good morning, Mr. Lloyd. Go ahead.
Thank you. If you refer to memo on page 34 of your board meeting material, this is a standalone document which provides a lot of information on the board's budget, both revenue and expenditures. I would like to highlight some of the information for you, and we'll see in the memo and provide a little bit more clarity. On January 10th, the governor's budget was released, which provided updated budget numbers for the board to include incremental adjustments to the board's current year, 2021 through 22, and the budget year, 2022 through 23 base budget, which was provided at the last board meeting. The board fund revenue and expenditures. The board began 2021 with a beginning balance of $14.1 million and collected approximately $18.7 million in revenue. After $5 million in loan to the general fund and expenditures of $15.4 million, the board ended 2021 with $12.4 million reserve balance, or approximately 9.7 months in reserve. The months in reserve equals the amount of time the board could function without any future revenues coming in. In 2021 through 22, and based on the governor's budget, the board projects an estimated $18.5 million in revenue. That number is estimated to remain fairly stable. However, the budget office will continue to monitor revenue and report back to the board if we see any significant variances. The board's expenditures for the current year are budgeted at $18.8 million. However, as of fiscal month 5, we are projecting the board to spend approximately $16.2 million. As with revenue and expenditures, projections will change as we are entering into the second half of the fiscal year. The budget office will continue to monitor these expenditures and report back to the board with monthly expenditure projections as the fiscal months close. A few things to note on the board's fund condition, page 38. SB 501 created an additional anesthesia permit and certificate types and fees. These fees are currently in the process of being established through the regulatory process and therefore are not projected in the fund condition statement at this time. The general fund loan of $5 million authorized in 2020 is scheduled to be repaid, with interest in 2023-24 budget year. The Dental Assistance Fund will be abolished as of July 2022, and the remaining funds will be deposited into the board's fund. Currently estimated to be deposited is $2.9 million. For expenditures, one of the main driving factors to the incremental increase in future years is the result of personal service adjustments. These include general salary increases, as well as employee compensation and retirement rate adjustments. The Budget Office includes an ongoing 3% increase to expenditures on the fund condition statement to account for these ongoing incremental adjustments. And lastly, we would like to note that that any future legislation or unanticipated events could result in the board's need for additional resources, which would increase cost pressures on the fund. The Budget Office will continue to monitor the board's fund condition statement and keep a line of communication with the board's executive staff open for any future needs or expectations. And with that, I thank you for the time, and we'll answer any questions the board has.
Thank you, Mr. Lloyd. We appreciate your comments. Are there any board member comments? Please use the raise hand feature. I am seeing none. Just another moment. No, I don't. I see none. Are there any public comments? DCA moderator, please facilitate the lines for public comment.
This is the moderator. If you'd like to comment on the budget report, please use that Q&A panel. Click on the Q&A icon, type the word comment into the text box, and submit that. Or for our call-in users, you can raise your hand by dialing *3. And seeing no requests, I will close the panel.
Thank you. We will now move on to agenda item number 8, the report of the January 28th, 2022 meeting of the Dental Assisting Council. I will ask Jerry Fowler, Chair of the Dental Assisting Council, to present this agenda item. Ms. Fowler, good morning.
Good morning. Well, my name is Jerry Fowler, and I'm Chair of the Dental Assisting Council. I will be presenting the Dental Assisting Council meeting report for the meeting held on January 28, 2022. The meeting minutes for the November 18, 2021 Dental Assisting Council meeting were approved with no revisions. The motion passed and it was carried. Agenda item 4, update on dental assisting examination statistics, and agenda item 5, update on dental assisting licensing statistics, were presented by Ricky Parks, Dental Assisting Program Analyst. Agenda item 6, update regarding RDA-EF licensure requirements and administration of the new RDA-EF written examination, was presented by Tina Valerie, Chief of Administration and Licensing. On January 1st, 2022, Senate Bill SB 607 became effective, removing the clinical and practical examination requirements to become a registered dental assistant and expanded functions in California. The new RDA-EF written examination that incorporates additional content that measures competencies related to cord retraction and final impressions was scheduled to launch January 1st, 2022. This new RDA-EF written examination is now the only licensure examination that RDA-EF applicants must take and pass to become licensed RDA-EFs in California. Ms. Valerie announced that the launch of the new RDA-EF written examination was delayed and it was launched January 28, 2022. Agenda item 7, update on dental assisting educational program and course applications and reevaluations, was presented by Ms. Tina Valerie. And then agenda item 8, discussion and possible action regarding recommendations of Council Working Group on RDA-EF administration of local anesthesia and nitrous oxide, was given by Ms. Tina Valerie and Dental Assisting Council Chair Jerry Fowler. Ms. Valerie presented the background information, stating that at the November 2018 meeting, Council heard a presentation from Joan Greenfield regarding a proposal to add the administration of local anesthesia and nitrous oxide to the scope of practice of the registered dental assistant in expanded functions. The Council directed staff to conduct more in-depth surveys of both dentists and a larger sample of RDAEFs to assess their opinions on adding the administration of local anesthesia and nitrous oxide to the RDAEF scope of practice. The Council also directed the formation of a working group consisting of dentists, hygienists, RDAEFs, and other interested stakeholders to research and evaluate the proposal. At the August 2021 meeting, staff advised the board that it does not have sufficient staff resources to carry out the Council's direction regarding the development of a survey and the formation of a working group. Board staff determined that to move forward with the Council's request, a board member would be needed to assist staff with the surveys and working groups. Board members expressed concern that it was unclear as to what the Council wanted to be studied. Some board members favored moving forward with the Council's recommendation, but would need additional information from the Council. A motion failed that would have moved forward with the Council's recommendation to conduct more in-depth surveys of both dentists and a larger sample of RDAFs to assess their opinions on adding the administration of local anesthesia and nitrous oxide to the RDAF scope of practice. At the November 2021 meeting, the Council was asked to reevaluate whether a survey and study of these issues needed to be performed. And if so, the Council was asked to define the specific issues to be studied and surveyed with a list of pertinent survey questions regarding allowing RDAF administration of local anesthesia and nitrous oxide. Given the lack of board staff resources and the complexity of the issue, the Council established a 2-member working group to discuss the specific issues to be studied and create relevant survey questions and return to the Council to report. The 2-member working group consisted of Jerry Fowler, Council Chair, and Tracy Reed Espinoza, Council Vice Chair. They met and developed survey questions to be given to the RDAFs and dentists separately for the Council's consideration and feedback. At the January 28th Dental Assisting Council meeting, Jerry Fowler, Chair of the Dental Assisting Council, reported that patient care and well-being is the #1 concern of the Dental Board of California, and patient comfort and happiness is every dental practitioner's goal. She stated that painful dental procedures and long appointments are practice killers and can cause dental phobias in patients. This concern for patient comfort and the dental practice fueled the focus of the survey questions. The survey addressed the following 2 issues. How long does the patient need to wait for additional local anesthesia and/or nitrous oxide to be administered? And procedure efficiency. How much extra time is added to the procedure by waiting for local anesthesia and/or nitrous oxide to be administered and take effect? The topic of determining if local anesthesia and nitrous oxide should become an allowable duty of the RDAEF is a 2-step process. Step 1, should we? This can be determined by gathering relevant data via a non-biased survey. Step 2, if yes to step 1, how do we proceed and implement? In order to collect pure, unbiased data, the committee suggested that the survey should be taken separately by RDAEFs and their employing dentists and/or DDS associates and hygienists who are responsible for administering additional local anesthesia and nitrous oxide to their patients. This will allow more validity to the survey results by cross-referencing the data results between dentists, hygienists providing the anesthesia with the RDAEF data results. The Department of Consumer Affairs Office of Professional Examination Services, OPES, reviewed the survey questions and has offered the following recommendations. Recommendation number 1, the Council initially administered 2 separate surveys, one to RDAEFs, who meet the qualifications for licensure established in 2010, and the other administered to dentists who supervise RDAEFs. If the survey is also sent to dental associates and RDH, or hygienists, OPES recommends that these be designed as separate surveys as well. However, the council may want to first obtain information from RDAEFs and dentists and then make a determination as to whether additional information from other dental professionals is indicated. Recommendation 2, the survey repeats questions by type of procedures performed by RDAFs in practice. Survey length and repetition of questions can impact response rates. Therefore, OPES recommends gathering data across procedures performed by RDAEFs under the scope of practice. However, if the council would like the information broken out, OPES is happy to assist. And recommendation number 3, OPES is willing to assist with revising the wording and scales for some of the survey questions to more accurately capture information. In addition, OPES is willing to assist with developing additional questions to include in the survey. So action was taken to instruct the 2-member working group consisting of Jerry Fowler, Council Chair, and Tracy Reed Espinoza, Council Vice Chair, to work with OPES to collectively develop and refine survey questions to report back to the Dental Assisting Council at their next meeting. The motion passed and it was carried. And that concludes my dental assisting report, and I'd be happy to answer any questions.
Thank you, Ms. Fowler, for that very complete report. I was at that meeting. Are there any board member comments? Please use the raise hand feature. Dr. Morrow.
Thank you very much. Thanks, Jerry, for your comprehensive report. I have a question. If you mentioned it, maybe I missed it. I've been in dental education for, as you know, a number of years. And one of my major emphasis has always been the quality of care related to the patient's experience of obtaining that care. In your survey questions, have you considered presenting some questions to the patient themselves regarding this issue of concern?
The original survey questions were meant for the RDAEF and the employing dentist to be taken. There was no questions in the survey at this point addressed to patients. I'm not sure if I understood your question right, Dr. Morrow. Right now, the questions are driven towards the wait time that it takes after the local anesthesia is administered before the patient or the RDAF can resume their duties, that entire wait time, as well as how that affects the procedure length. So right now, that's how the questions are worded, but we're going to be working with OPES, and I'm sure these are going to be revised a bit.
Okay, thank you very much.
Thank you, Ms. Fowler. Once again, any other board member comments? I assume Dr. Morrow is going to unstick his hand. Any other board member comments? Dr. Montel.
Hi, this is Dr. Montel. I just would like a little clarification. I'm just a little confused. How the RDAEF giving the anesthesia is going to help the patient experience be better. I mean, I'm just confused as to why the wait time for anesthesia is affected either way by whether the dentist or the RDAEF or the hygienist gives it. Can you just clarify that for me? Thank you.
Many times in a private practice, the dentist, after whether it's restorations, crown preps, after he's done his part with prepping, he leaves the room and goes and sees another patient, leaving the RDAF to work alone to complete the procedure. In the course of that work that the EF is doing, sometimes, many times, anesthesia is depleted and needs reinforcing. And so the EF has to go and ask the doctor to give additional anesthesia. So there's a period of time that the patient is sitting in the chair waiting for whether it's a DDS associate, employing dentist, sometimes hygienist will come and reinforce as well. there's a period of time the patient is in the chair waiting, needing additional anesthesia. And then once that comes, once they can dismiss themselves from what they're doing to come give the additional anesthesia, then also that anesthesia needs to kick in or become effective before the EF can resume their work, which also lengthens the procedure time. And that's the data. That actual amount of data is what we need to collect from this survey to find out how much time we're actually talking about and how often.
Thank you. That's very helpful. Appreciate it.
Are there any other board member comments? Are there any public comments? DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to myself or our panelists. For our call-in users, you may raise your hand by dialing *3. Our first comment comes from Susan McLaren. Susan, I've sent the request to unmute your microphone.
Yes, this is Susan McLaren, representing the California Dental Hygienists Association. And CDHA wants to applaud the efforts of the Dental Assisting Working Group to develop meaningful data on the need for RDA-EFs to be trained to administer local anesthesia and nitrous oxide. However, CDHA stands firmly opposed to that concept, and its opposition is based on the facts that, as stated, implementation would result in the reduction of educational standards. This reduction in educational standards would be of potential harm to consumers. Furthermore, the data presented so far does not support the need for this expansion of scope of practice. Please refer to the objections raised by CDHA at the Dental Board meeting of November 29th, 2018, and the attachments, including a letter from CDHA President Beth Wilson with attachments about the RDH and RDH-EF comparison of educational prerequisites and course requirements. Also a copy of Title 16, Division 11, Article 3, Section 1108, Educational Programs, and also the letter submitted in opposition by Dr. Stanley Malmud, which starts on page 172, and his attachments, including the ADA statement on teaching dental students pain control. Thank you very much.
Thank you. And seeing no additional requests for comment, I will close the panel.
Thank you. There's no vote necessary. This is an information only report. So at this point, we will move on to item number 9 on the agenda, the discussion and possible action regarding appointments of DAC members. We're going to ask Board Member Alagi to present this to us. Good morning,
Thank you.
Alagi.
So I first want to start and give a thank you to all board staff and all 37 dental assistants who showed interest and completed the application to become a DAC member. 37 applications were thoroughly reviewed by myself and Ms. Pacheco. 17 applicants met the qualifications to be interviewed for the 2 vacancies. From there, 16 applicants' interviews were completed, and it was determined that Deandra Epps Robbins, registered dental assistant, and Candace Ray Pliss, registered dental assistant, are being recommended to be appointed to the 2 positions for clinical members on the Dental Assisting Council. In addition, we would like the board to consider reappointing Kara Misaki, registered dental assistant, to fill the vacancy of one of the DAC members who is employed as a faculty member of an RDA educational program. Ms. Mizasaki has served a partial term, which expires this March 2022, and seeks reappointment for her current DAC member position. Both myself and Ms. Pacheco recommend to reappoint Ms. Mizasaki to the same position for a term of 4 years expiring March 2026. It's asked that the board consider the subcommittee's recommendation to appoint the 2 candidates to fill the open DAC member positions for RDA members employed clinically in private dental practices or public safety net or dental healthcare clinic. And in addition, asked to consider the subcommittee's recommendation to appoint Kara Marasaki, the DAC member employed as a faculty member of an RDA educational program approved by the board. Thank you.
Thanks, Ms. Alagi. With respect to the appointment of any of these individuals or reappointment of these individuals, let's do them one at a time for respect of their positions. Let's start off with Ms. Deandra Epps Robbins, RDA, to be appointed as a new member of the DAC. Is there any board comment on the lady, on the position and her? I see none. Is there any public comment on the appointment of Ms. Epps Robbins? DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've opened that Q&A panel. If you have a comment on this individual, please use that Q&A panel to submit your request. Or for our call-in users, you can dial *3 to raise your hand. Seeing no requests at this time, I will close the panel.
Thank you, moderator. We need a motion and a second to move the appointment of Ms. Deandra Epps Robbins to the Dental Assisting Council. Do we have anybody who is going to do that for us? I see Dr. Morrow. Oh, go ahead, Dr. Morrow. Dr. Morrow, you gone? All right, Ms. McKenzie, I see you up there. Go ahead.
I'm just going to move.
Okay, thank you. Ms. McKenzie moves the appointment of Ms. Epps Robbins. Is there a second?
Morrow, second.
Dr. Morrow, thank you, sir. All right, is there any further discussion on this from the board? Seeing none, we're ready to vote. Board Secretary, will you please call the roll on the appointment of Ms. Deandra Epps Robbins to the Dental Assisting Council?
This is Tara Welch, Board Counsel. We need to take public comment on this motion.
I apologize. I thought we had that already. But okay, let's do that then. The public comment, DCA moderator, please facilitate the comments. I believe we did that. Moderator, did we not just a moment ago? If not, go ahead and open up the mics again.
This is the moderator. I've again opened the Q&A panel. If you'd like to comment on this motion, please use that Q&A panel to submit your request for comment, or for our calling users, dial *3. Not seeing any requests, I'll close the panel.
Okay, very fine. Thank you, and we stand corrected. We are ready to take the vote. Dr. Molina, would you care to call the roll and take the vote for us?
Yes, the motion is to appoint Deandra S. Robbins to the DAC as a DAC member. Chan,
Aye.
aye. Fissenfeld,
Felsenfeld, aye.
aye. Larin,
aye.
aye. Mackenzie,
McKenzie, yes.
Aye. Medina,
Aye.
aye. Mendoza,
Mendoza, I.
aye. Molina, aye. Montel,
Aye.
aye. Morrow,
Morrow, aye.
aye. Olagi,
Olagi, aye.
aye. Pacheco,
Pacheco, aye.
aye. And you, Dr. Yu?
Dr. Yu, you are muted. You'll need to make sure both of your devices are unmuted.
Now, this Dr. Yu.
Yes,
Hello?
Dr. Yu.
Yes.
How do you vote?
Yes.
Yes, okay. So you are, aye, motion passes.
Thank you, and congratulations to Ms. Deandra Epps Robbins. We look forward to working with you in the future. The next candidate for a dental assisting council position, I should say, is Ms. Candace Ray Pliss. We will ask for any board member comments on this candidate. Seeing none, we will then ask for a nomination and a second. Motion, I should say, to nominate and a second. Ms. McKenzie.
I so move.
Move the nomination or the acceptance of Ms. Candace Ray Pliss. Is there a second? Dr. Morrow, is that you, sir? Dr. Morrow, did you second that?
Morrow.
You're fading in and out, Dr. Morrow. Tell you what.
Morrow, second.
Thank you, Dr. Morrow. You've seconded the motion. All right. At this point, is there any public comment on this motion?
This is the moderator. We've opened that Q&A panel. If you'd like to comment on the motion, please click on the Q&A icon on your screen, type comment into the text field, and submit that to myself or our panelists. For our calling users, you may raise your hand by dialing *3. And seeing no requests, I will close the panel.
Thank you. We are now going to take the vote on the appointment of Ms. Candace Ray Pliss to the Dental Assisting Council. Will the board secretary please call the roll?
So the motion is to appoint Ms. Candace to the DAC as a DAC member. Chang.
Chan, aye.
Besenfeld.
Yes, Felsenfeld, yes.
Besenfeld, aye. Larin.
Larin, yes.
Larin, yes, aye. Mackenzie.
Mackenzie, yes.
Mackenzie, aye. Medina.
Medina, I.
Medina, aye. Mendoza. Mendoza.
Member Mendoza, you are muted. If you're using a phone and a device, both will need to be unmuted.
We'll get back to Member Mendoza. Molina, aye. Montel.
Montel, I.
Montel, aye. Morrow.
Morrow, aye.
Morrow, aye. Ulagi.
Olagi, aye.
Olagi, aye. Pacheco.
Pacheco, aye.
Pacheco, aye. You.
You, I.
You, aye. Member Mendoza. So we have 7 ayes, so motion passes.
Thank you, and we'll mark Mr. Mendoza absent for this particular one. Except, moderator, do we know if he's still on with us?
He is still connected.
Okay, so we'll mark him absent for this one. Thank you. And congratulations again to Ms. Candace Ray Pliss, who will be coming and joining us on the DAC. We look forward to hopefully meeting you, but certainly working with you. The last of the requests is to reappoint, and I have it here, Ms. Miyazaki, and I don't have her first name. I'm so embarrassed to say. Forgive me. Ms. Miyazaki is a member. Kara Miyazaki is a current member. And I think let's do this. Let's see if there's any board comment on the reappointment of Ms. Miyazaki to the Dental Assisting Council. Is there any board member comment? No board member comment? Raise your hand, please, if you want to speak. I heard some comments in the back, but Okay, it does not appear to be any, so let's have a motion then to reappoint Ms. Miyazaki to the Dental Assisting Council. Dr. Liren?
Motion to appoint.
Thank you, Dr. Liren. Is there a second?
Chan, second.
Chan, Dr. Chan. Thank you, sir. We got a motion and a second. Is there any public comment on this motion?
This is the moderator. We have opened that Q&A panel. If you'd like to comment on this item, please use the Q&A icon to type comment into the text box and submit that to us. Or for our call-in users, you can dial *3. And seeing no requests, I will close the panel.
Thank you. Dr. Molina, will you please take the vote on this motion?
Yes, so the motion is to reappoint Karen Miyazaki as a DAC member. Chan,
Chan,
Chan, I. Fessenfeld,
Felsenfeld, aye.
Fessenfeld, I. Larin,
Larin, aye.
Larin, I. Mackenzie,
Mackenzie, yes.
Mackenzie, I. Medina,
Medina, aye.
Medina, I. Mendoza. Okay, Molina, I. Montel,
Montel, I.
Montel, I. Morrow,
Morrow, aye.
Morrow, I. Olagi,
Olagi, aye.
Olagi, I. Pacheco,
Pacheco, aye.
Pacheco, I. You,
UI.
I. Mendoza? So we have 7 ayes. The motion passes.
Thank you, and congratulations again to Ms. Miyazaki for joining us again on the deck. Let us turn to move item agenda 10A, the update on the Attorney General's annual report of accusations prosecuted for the Department of Consumer Affairs Client Agencies, Business and Professions Code, Section 312.2, January 1st, 2022. I will ask Carl Sohn, I hope I'm saying your name correctly, sir, the DOJ Senior Assistant Attorney General, to present this agenda item. Mr. Sohn.
Yes. Good morning, President Felsenfeld, members of the board, Assistant or Interim Executive Officer Sarah Wallace. My name's Carl Sani, and I am the Senior Assistant of the Licensing Section at the Office of the Attorney General. Licensing is a section at the Department of Justice that is charged with handling the enforcement work for the dental board. We have about 120 attorneys and paralegals that I supervise, and we represent the dental board in enforcement matters as well as other agencies. Maybe we can go to the next slide and put up my presentation. Thank you. And maybe we can even jump ahead one more. So I'm here this morning to report on and summarize the Attorney General's report that is prepared annually pursuant to Business and Professions Code Section 312.2. And so as I do that, I'm going to give you first an overview of the background of this report. And then I will move to the data collection process, and then quickly summarize all the work for the agencies, and then move to the data specific to the dental board. By way of background, this is the third time I've been before you. Each time it's been a pleasure. I can tell you that our attorneys enjoy very much working for the dental board. The dental board has a sophisticated and robust enforcement program, and I have handled many cases myself, and it's just a pleasure to work for the board. The report that I'm going to summarize today was published on January 1st, 2022 for the fiscal period of 2020 to 2021. So this slide on the background summarizes why we are reporting the data that I'll be covering here today. It's a function of a statute, SB 467, that was passed in 2015 that required the documentation and memorialization of all the case processing aspects of matters that our office is charged with. It became effective in 2016, and our very first report was prepared in 2017, but the report that is most meaningful for our purposes was done on January 1, 2019, because at this point, we consolidated our methodology with the health quality enforcement section at the Department of Justice. It's our sister section that also does reporting, and we consolidated all reporting together. And the goal of this reporting is to ultimately identify trends. But at this point, we're in the fifth report, and really 4 reports that are, I think, really comparable to each other. But it's still pretty early to identify any trends, but we'll go through some of the data today. Next slide. So how this data was collected. At the Attorney General's office, we use a piece of software called ProLaw. It's our case management system by which we document all of our data for each case that we work on. ProLaw has about 200 users, including the attorneys at Health Quality Enforcement. And each case that we receive from an agency, such as the dental board, is opened in that software system and tracked. And all users enter data, and periodically that data is audited and validated. And what that data includes, for example, are kind of various milestones of events in the course of a given case. That would include the date the case is referred to us, the date on which a case is filed, that is an accusation case, the date a hearing is commenced, the date the hearing is submitted to an administrative law judge for adjudication, and then the ultimate date of resolution. Let's move to the next slide. So looking at the entire Department of Consumer Affairs, which includes about 37 agencies, you can see that accusations reflect about 1/2 of the matters that are referred to the Attorney General's office. So the report under 312.2 only includes data as to accusations, but we also receive many other referrals from client agencies such as the Dental Board for statement of issue cases, petitions for reinstatement. We often are conducting cases in Superior Court on what are called petitions for writs of mandate and Court of Appeals work as well. Those are not reported in this report I'm covering today. You can see that there has been a slight decrease in referrals over the last 2 years, and yet pretty stable, a slight decrease in adjudications. I can't really speak to a particular change like the decrease in referrals or adjudications, but I will say that everything that's happened in the last 2 years is against the backdrop of the COVID-19 pandemic, which has had many impacts on all agencies, the Attorney General's office, and the Office of Administrative Hearings. Let's go to the next slide. So this now turns exactly to the data specific to the dental board. And as you can see, comparing this past year to the year before, you see a dramatic increase in the number of accusations referred to our office. And as I was looking over this slide, I asked the question that you would probably all ask, which is why? And as you may recall, those board members who were here last year, I gave a very similar report and reported on the data from 2018-19 to that year, 2019-20. And so what it shows is that in 2018-2019, we had 98 referrals from the dental board and 2 matters rejected. So what I suspect is happening here, or I think a reasonable conclusion, is that there was an impact on COVID-19 and things over this past year have normalized for the most part for the board of the dental board. Next slide. This slide depicts further investigations. So what are further investigations? Further investigations are matters where the Attorney General's office has received a referral from the dental board or another agency, and it examines the file and requests, after a review of the file, that some further investigation be conducted. It may be that witness statements need to be taken, people need to be interviewed, or additional documentation received. This past year, there were only 8 of those cases. That's actually a pretty small percentage and not that remarkable. And it's pretty steady from year to year. Next slide. And again, this is accusations filed. So the prior slide that showed the dramatic increase in accusations referred parallels this slide, which shows accusations actually filed. So the referred matters mean that we have received the file, and then after we have examined the file, we will prepare what's called the accusation charging document. And this reflects the accusations that are actually approved and filed by the agency. Again, we see a big increase from 2019-20 to 2021. But again, if you look back on 2018-2019, this shows that there were 97 accusations referred, exactly the same number as in 2020. So there was a dip in 2019-20, and now it seems to have normalized. Next slide. Accusations withdrawn depicts those matters where the agency, after any one of a number of circumstances, will determine that it does not need to proceed to hearing. Those numbers are very stable. Accusation matters adjudicated refers to those cases which actually go to hearing and which there is a decision which the board then considers, and it is, as you can see, absolutely stable. Next slide, please. This slide depicts the various timelines that we are reporting in our case processing system. So accusations received to accusation filed means that we have taken roughly 99 days to prepare the accusation in 2019-20, and we improved that timeline to 92 days in 2021, which is a positive trend. But again, with 2 data points, it's hard to make much sense of that. But if you go back to 2018-2019, which I did last night, it shows that it took in 2018-2019 118 days. So that demonstrates that over 3 years, we have made a significant reduction in the time it takes to present a case to the agency for filing. The next number shows accusation filed after further investigation. And this shows, again, a decrease, which is positive. And 2018-2019, which I looked at last night, showed about 237 days. So this past year was a dramatic increase. So let's go to the next slide. So this depicts when the time period between after an accusation is filed, that's actually signed by the agency, to the time it takes to reach a settlement. And again, in this case, we've seen an improvement of about 10%. And you might ask, why does it take 300 days to reach a settlement? Well, I think it's sort of common knowledge that there are events that need to take place between the time an accusation is filed to the time of settlement, and that usually involves providing discovery to the other side, responding to any special requests that the other side has. And then as the hearing dates often get closer, the parties can identify what the likely outcome of a hearing may be, and that precipitates a settlement. But then again, that's a positive trend. The accusation filed to default, again, is a very positive increase. And that just shows that, we are identifying the circumstances necessary for a default ever earlier. Although the number of cases involved in the default is only 7. So that's not too demonstrative of much as a data point goes. Let's go to the next slide, please. Okay, this measures the 3 different time periods: the accusation filed to the hearing requested, and shows, and as well as the hearing date received to hearing commenced. So what do these communicate? Well, it shows an improvement from 2019 to 2021 of about 8%, and a slight increase from the date a hearing is received to hearing commenced. And again, I would say that this is also probably being affected by COVID-19. There are many parties here that are dealing with the consequence of COVID-19 and providing digital discovery to the other side, getting hearing dates from the Office of Administrative Hearing. There are many factors, but again, it is a positive trend. The total number of days, as you can see, there is a slight improvement from year to year. Next slide. As I conclude this presentation, what is important to remember is it takes time to process cases in the enforcement process. Our goal, which was a function of the Consumer Protection Enforcement Initiative back about a decade ago, is to reduce the time from total processing to 18 months, and that's a challenging goal. One of the reasons is under our legal system, there is due process given to the licensees that we bring accusations against. So that involves, it's a robust system where parties engage in discovery and assure themselves that they have all the documentation necessary for the matter to be adjudicated. And I will say, not intending to be humorous, but when we have sophisticated clients like the Dental Board of California, that often results in the licensing retaining counsel and attorneys often, when they represent respondents, add a level of complexity as they ensure that their clients are given all due process that they're entitled to. That being said, I think we see some positive trends here, and we are striving at the Office of Attorney General to adjudicate cases as expeditiously as possible while still ensuring that there is due process for every licensee. Finally, if you look at the report that you've been given, that I think is about page 68 or so of your materials, it will show the data for all of the agencies within the Department of Consumer Affairs. One of the important considerations, though, that we always recommend is that agencies cannot be compared to other agencies. And so it is important to focus precisely on the dental board rather than measuring the board against other agencies, which have sometimes better metrics, sometimes worse metrics, and sometimes just different metrics in different categories based on the issues particular to each individual agency. That concludes my presentation. President, members of the board, Interim Executive Officer.
Thank you, Mr. Sine. Are there any board member comments on the report? Seeing none, no raised hands. Seeing none, DCA moderator, let us see if there are public comments. Please facilitate the lines.
This is the moderator. We've opened that Q&A panel. If you'd like to comment on this presentation, please click on that Q&A icon on your screen, type comment into the text field, and submit that to myself or our panelists. For our call-in users, you can raise your hand by dialing *3. And seeing no requests, I will close the panel.
Thank you very much. I believe Ms. Wallace wants to make a comment.
Yes, thank you, Dr. Felsenfeld. I just wanted to thank Carl and his team. They've been an absolute pleasure to work with and have been very helpful with my transition into the interim EO capacity. I also wanted to comment on the increase in accusation matters. That is something that board staff has been looking at, and we believe it's attributed to cases that were transmitted to the AG's office that were part of a bigger case that the board is reviewing right now. So while it does appear to be a larger number, it is on target with what we were expecting as we adjudicate one larger case.
All right. Thank you very much. It is now 10:40. How about 15 minutes? We'll be 10:55, and we'll come back after a brief break, okay? We'll see you back in 15 minutes. Thank you. Welcome back. Moderator, do we have everybody back with us? Can you tell?
Everybody, let me double check and see if everybody's still connected.
Thank you.
The only person we're missing at the moment, and let me see if he's rejoined, is the only person we're missing is Mr. Mendoza. I believe he was having some technical issues.
We've been having problems with his connection most of the morning here, so okay. Well, we're ready to go back. I offer an apology. I was a little quick to complete the action on the, or at least the item relative to the Attorney General's report, and I've neglected to ask for public comments. So at this time, moderator, will you please facilitate public comment on the Attorney General's report?
This is a moderator. We've opened that Q&A panel. If you'd like to comment on the presentation that we received prior to break, please click on the Q&A icon on your screen, type comment into the text field, and submit that to myself or our panelists. And for our call-in users, you can dial *3 to raise your hand. And seeing no requests, I will close the panel.
Thank you very much. Did not mean to in any way shortchange anyone's ability to make a comment on an item that is on the agenda. We will now move on to agenda item 10B, the Enforcement Report Review of Statistics and Trends. I will ask Mr. Carlos Alvarez, our Chief of Enforcement Field Offices, to present this agenda item. Good afternoon. No, it's still morning. No, it's still morning. Yes. Good morning, Mr. Alvarez.
Good morning, Board President and board members. Carlos Alvarez will be presenting for agenda item 10B, enforcement statistics. The statistics that were gathered were October 1st of 2021 through December 31st of 2021. And on this report, we actually have some highlights here. So between that timeline, the Complaint Compliance Unit received 967 complaints. So from the time of my last report in November, the number of complaints that the board received actually decreased. So it decreased by 209. So that's really good that we received less complaints. Number of complaints, cases that are open, again, another highlight. We have 635 complaint cases that are open within our Complaint Compliance Unit. And this decreased from my last report in November. The number of cases that were open decreased. So that's a really good job on our Complaint Compliance Unit staff, managers. The cases decreased by 334 cases. So again, that's with the staff following the work processes, staying on top of their, monitoring their timelines, the manager monitoring the processes and the workflow. That's a really good job there. And also, this takes account too for internal and our external dental consultants who are reviewing these cases for us. So that's a really good job for us that we could turn around and decrease the open complaints in our Complaint Compliance Unit. The number of complaint cases that were closed in the unit was 1,003 complaints. And again, this is after it's being reviewed by dental consultants to determine whether there's violations of the Dental Practice Act. So if they determine that there's no violations, those cases get closed. Moving on to our enforcement unit. Again, the number of cases that are open in our enforcement unit, and that's for our non-sworn personnel. That's for our sworn personnel, and here in the Sacramento office and our Orange office. So the number of cases that are open currently right now is 1,050, and this number has decreased as well. So it decreased by 167 cases. So that's really good news that, again, our investigative staff, our managers are staying on top of the timelines, are monitoring their cases, and really working through these cases and monitoring the timeframes. So that's really good news on that. So currently right now, the number of cases that were closed for Sacramento field office and the Orange field office was 190 investigative cases. Currently right now, move on to inspections. As of December 31st of 2021, currently there's 127 inspection cases that are open. So these inspections is when consumers submit a complaint saying that there's unsanitary conditions in the dental office that they visited, then in turn we open up an inspection. Then our inspectors or investigators go out and conduct an inspection of the office. So currently right now in our Sacramento office, we have 29 inspection cases, and our Orange field office, we have 98 cases. So the total number of cases that were closed, inspection cases that were closed, were 35 for October 1st through December 31st of 2021. So currently right now with accusations that were filed between October 1st and December 31st, there was 24 accusations that were filed with the Attorney General's office. And currently right now, there were 47 cases that were transmitted to the Attorney General's office for consideration of an accusation. And as of December 31st of 2021, there are 217 cases that are pending at the Attorney General's office. Also, I'm moving on to citations. So we issued 15 administrative citations through that time period of October and December 31st of 2021. And examples of some of these citations that we issued. So it could be poor record keeping. So after it went to a dental consultant or an expert, they determined that the licensee had poor record keeping. So we'll issue a administrative citation for that. Or if a licensee failed to submit records within 15 days, then we'll issue an administrative citation for that. And I'll be moving on to the number of probation cases that we currently have. So these are licensees that are being monitored by our investigative staff. So currently right now we have 141 probationers that are being monitored. And out of the 141, 132 are active probationers. And we have 9 licensees that are toning, meaning that they're out of state. They're still being monitored, but they're out of state, so their time doesn't count. So once they return back to the state of California, they start working again here in the state of California, then their time reactivates and their probation then starts counting. The probation time starts counting. And so that concludes my report on the enforcement statistics. But also, if you notice, we also added in this report, we also added past fiscal year statistics from 2018 through 2021.
Thank you, Mr. Alvarez. We can see that, and it looks like things are doing well for you guys. Are there any board member comments on the report? Raise your hands, please. Dr. Chan.
Good morning. This is Chan. Good morning, Carlos.
Good morning, Dr. Chan.
Do you notice any trends or upticks with post-COVID 2020 and 2021 with, and I'm not quite sure the jurisdiction with Cal OSHA or the California Department of Public Health for any not citations, but any complaints about the hygiene of an office. Are you noticing any kind of trends?
No, we haven't received any type of, like I said, unsanitary conditions because of COVID. Primarily, it's that they're saying that they saw that the equipment was either dirty, tools were either dirty, but we haven't received any complaints because of COVID. But if we do receive anything that's related to COVID, then that either we forward those to either the county or state health facilities, I should say.
Great, thank you, Carlos.
Are there any other board member comments on the report? Seeing none, are there any public comments? DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on this item, please click on that Q&A icon on your screen, type comment into the text box, and submit that. Or for our call-in users, you may raise your hand by dialing *3. I'm not seeing any requests. I take that back. We do have one request from Dr. Bruce Witcher. Dr. Witcher, I've sent the request to unmute your microphone.
Am I unmuted?
You are.
Thank you. Yeah, I just really appreciate Ms. Wallace pointing out that there is a reason for the uptick in accusations that went up to 96, which is an increase over last year. And so I guess that was a complex case that involved a lot of accusations going out. So that was helpful in understanding the context of that finding. Other than that, everything looks to be headed in the right direction, as Dr. Felsenfeld pointed out. Thank you.
Thank you. And seeing no additional requests, I will close the panel.
Thank you. We will now move on to agenda item 11A, the report from the Commission on Dental Competency Assessment and Western Regional Examination Board, the CDCA REB. I will ask representatives from the CDAC REB to provide the report on this agenda, and please identify yourself before you speak.
Good morning, President Felsenfeld, board members, and staff. I bring greetings from ADEX. This is Dr. William Pappas, president of ADEX. We've inundated you with PowerPoints the last few years, so I don't have a formal report. I will welcome any questions that board members have. And if there's a particular topic you'd like us to address in a future presentation, I'd welcome that as well. Thank you.
All right, thank you, Dr. Pappas. And you're representing the combined CDCA REB, is that correct? Or is it going to be a secondary report from the REB people?
No, it's a unified report.
Okay,
Thank you.
So we're going to one now. Very good. Do we have any board member comments or questions for Dr. Pappas on this topic? Seeing none, are there any public comments? DCA moderator, please facilitate the lines for public comment.
This is your moderator. We've again opened that Q&A panel. If you'd like to comment on this item, please use that Q&A icon to access the text box and submit the word comment. For our call-in users, please dial *3 to raise your hand. And seeing no requests, I will close the panel.
Thank you, and thank you, Dr. Pappas. We will now move on to agenda item 11B, a presentation on the Central Regional Dental Testing Service exam, the CDR-TS credits as it's known. I'm going to ask Rachel Kobler, I believe her name is, the Executive Director for Credits, to provide the report on this agenda item. And good morning, Ms. Kobler.
Good morning, Chairman, and I appreciate you. My name is Rochelle Cobbler, spelled a little differently, so everybody gets that wrong. But Rochelle Cobbler, Executive Director here from Credits, and we appreciate you giving us an opportunity to present. I also have, I believe you may be able to see, moderator, in the queue there is Kim Laudenslager. She will also be presenting. I didn't know if it would be a possibility to unmute us at the same time or not. If not, we can just let you know when we're going to sort of switch off, if that's okay.
You have control of your microphones.
And I did unmute myself, Shelley, so thank you.
Wonderful. Okay, thank you very much. As I mentioned, I'm the Executive Director here at Credits, and I am located in Topeka, Kansas, which is where our central office is located also. And we do have a short presentation. It looks like that's up on your screens. As I mentioned, Kim Laudenslager will also be on this presentation. She's a dental hygienist, and she has been in practice and with Credits for over 27 years. Kim has enjoyed a long time relationship with the California State Board as far as dental hygiene is concerned. And so she's got some great history that she'll talk a little bit more about later. Kim recently transitioned into the role of Director of Communication and Education for Credits. And so she'll continue to be a great source for the board for any questions regarding dental hygiene, but also for dental going forward. Okay, ready for the next slide, please. Thank you. As we evaluate the ways that we serve state boards and in helping them to achieve their mission, it's important to Credits that we ensure that our mission is in line with those state board missions. As we look here at the Dental Board of California's mission and our mission, it's clear that Credits is both Credits and the Dental Board of California have the same mission of protecting the public. And we provide the necessary evaluation for the competency of those wishing to practice in the professions of dentistry and dental hygiene so that you can then assess whether they're ready to be licensed. Next slide. Thank you. Portability is a really prominent discussion right now in dental and dental hygiene testing world. Credits is already accepted in over 40 states for initial dental and dental hygiene licensure. And recently, states such as Hawaii have begun to recognize that by only accepting certain testing agencies, they're impeding the candidate's ability to move throughout the country. So Hawaii has recently introduced legislation to revise their statutes and accept other nationally recognized clinical dental examinations. I visited with Miss Wallace and had the pleasure to talk with her for a little bit. She graciously spent time with me to discuss the process as it pertains to the Dental Board of California. And I understand that the first step is to request that the board initiate a review of the Credits dental examination by OPES. I know that Kim and Credits has worked with OPES in the past, and Kim is very familiar with that. So we understand that this isn't a short process and that it will take time and that that's the first step. But we would like to request today that the board initiate that process with OPES and ultimately expand the current legislation to include the acceptance of Credits dental examination as a pathway toward dental initial licensure as you already accept for dental hygiene. I'm going to turn it over to Kim now, if you don't mind. I think we're ready for the next slide.
Thank you. And I am familiar with a few of you on the dental board, and we welcome this opportunity to talk today. My history with California started actually when the Dental Hygiene Committee of California was first started, and then of course evolved into the board. And we credits have been testing hygienists in California now since 2013 and continue a great relationship with many of the schools and candidates there. And I was involved in the process again with them in getting credits accepted into that process for initial licensure. So I think if we work with Miss Wallace and you, we just take direction from you. That's what we did the last time. And what Shelley just mentioned is that's what we want to continue with. If you want to go to the next slide. Next. Some of the things we will deal with OPES on our statistics, but we wanted to take this opportunity to share with you that we have been creating our own testing site in Topeka, Kansas, as it was requested by many of our member state boards. We needed to have another testing site for some of the candidates, dental and dental hygiene, that might not be on track to graduate with their class due to COVID, and they needed an off-site testing center. So we're excited about this, and also excited with the fact that we've partnered with SimToCare. I'm not sure if you're familiar with them, but SimToCare is, they claim, the next generation of simulated educational testing or teaching, and their product, the actual product called the Dante, which I think UCLA is one of the few dental schools in the country. They have 5 of these. So we will be using this per the state boards. Again, it's our state boards that direct what we do. They were telling us that they had current licensees that were either in a disciplinary situation or perhaps needing some remediation that the board had directed, but then they needed reevaluation and they wanted a third-party independent reevaluation. So we're using our independent testing sites to help our member state boards with that. So we just wanted to let you know, we think that's exciting. Next slide, please. And we also wanted to share with you that Alpine Testing Solutions is who Credits also partners with or works with as our independent psychometric and testing analysis, data analysis, all of our statistics. And Alpine is already familiar with working with OPES. So we will continue to supply whatever you need through our independent testing or psychometric evaluation for OPES. And then next slide, please. So I think what Shelley had mentioned is Ms. Wallace told us, and thank you, Sarah, for doing this, that we needed to work with perhaps OPES per the direction of the dental board, that the last time we worked, I think it was just a couple years ago or last year. I think we might work with them every year on the hygiene exam analysis. And so you direct us, and we would look forward to providing any information we need to on our dental exam. We already have, just so you know, we've looked at the statute. I know section 1630 directly involves the examination, and then section 1632 C1A, 2A, B, etc. And that's what we're looking at, and that's why I think Shelley was suggesting Hawaii and some other states that have it in statute, that it will require, at least we think, a legislative change. And we need to work with you on whatever we can do to help that process along. And that's where we are looking ahead. Next slide, please. So again, I think the conclusion to credits, I would hope that if you have questions on any of our exam specifics, Ms. Wallace said that today we probably just needed to be concise and say hello and remind you that we're here and looking forward to working with you in the future, but we're always available to answer any of these questions that are specific to our dental exam. And next slide, please. So we welcome any questions that you might have. And we've also provided Ms. Wallace, I think if you show the next slide, please. We have several individuals that have connections in California, and we would be willing to make any on-site visits or anything that you need us to do to provide the information necessary to move forward. I think that about does it.
Well, thank you, ladies, for being concise. We appreciate that. I'm going to ask Sarah Wallace to weigh in a little bit because she has been talking with you about process, and that will help guide us for the future. So, Ms. Wallace?
Thank you. Thank you, Shelley and Kim, for coming today. I wanted to preface this. Credits reached out to Karen and I last summer and had requested to provide a presentation to the board regarding the Credits dental examination for licensure in California. And so at this point, at this meeting, Credits has come to provide their presentation regarding their examination. I shared with Shelley earlier last week that the board had met in November and had heard a presentation from the Office of Professional Examination Services in which you discussed dental licensing examinations and the utilization of the varied formats of examinations that are available for consideration by the board. At that meeting, you had also prioritized the review of certain examinations. OPES is limited in the number of reviews that they are able to conduct for us. As I previously reported, we keep them very busy with the review of our written examinations that are administered by the board through the PSI vendor, as well as the review of our other examinations that we require for licensure. And currently, the DLOSCI and the California Portfolio Examination are in queue to be reviewed. So the next step is to consider, and we're not asking for any action today, just to clarify, but the next step would be to have the board discuss this at a future meeting and determine whether or not they want to embark on reviewing the credits examination. And so I will work with Dr. Felsenfeld on future agenda items. And at that point, we would also invite the Office of Professional Examination Services to come back and present on the information that they've provided previously. And at that meeting, depending on what the board wishes to do, we would also ask that the board prioritize the review of the examinations so that we're clear on which exam should be conducted first. So I'm happy to answer any questions. I hope that clarifies where we are in the process. After consulting with OPS, it does appear that it's preferred to have examination reviews conducted prior to seeking statutory authority. And so just to reiterate, this is a very long process to ensure that we are validating examinations and that we're adhering to the statutory requirements for licensure examinations. And again, I'd be happy to answer any questions.
All right, thank you, Ms. Wallace. Are there any board member comments or questions for either Ms. Wallace or the team from Credits? Raise your hand, please. I see none at this time. Oh, wait, there goes, no, that's you guys. I see none at this time. So are there any public comments? DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've opened that Q&A panel. If you'd like to comment on this presentation, please click on the Q&A icon on your screen, type comment into the text field and submit that. And for our call-in users, you may press *3 to raise your hand. And seeing no requests, I will close the panel.
Thank you, and thank you, ladies, for your presentation once again. We will now move on to Agenda 12A, the review of dental licensure and permit statistics. I'm going to ask Paige Regali, the Acting Licensing and Examination Unit Manager, to present this agenda item. Ms. Regali.
Thank you, Dr. Felsenfeld. My name is Paige Regali. I'm the Acting Dental Licensing Unit Manager, and today I'll be presenting Agenda Item 12A, Review of the Dental Licensure and Permit Statistics, which begins on page 114 of the meeting materials. This memo is an overview of the dental license application statistics, the dental law and ethics written examination statistics, and the dental license and permit statistics. It also provides an overview of license and permit statuses, such as active, inactive, delinquent, canceled, and retired or disabled where applicable. Page 121 of your meeting material indicates the last occupational analysis done by the Office of Professional Examination Services was done in 2018, with the target date for the next occupational analysis being in 2025. Moving on to page 122 of your meeting materials, the tables provide statistics on the dental license and permit statuses by fiscal year and continues to show current and active dental licenses by county and the population per dental license from 2019 through December 31st of 2021. Currently, Yuba County has the highest population per dentist, and San Francisco County has the lowest population per dentist. This concludes this agenda item, and I'm available for any questions. Thank you.
Thank you, Ms. Regali. Appreciate that. Is there any board comment or questions at this time on this topic? Please raise the hands. I see none. Are there any public comments? DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on this item, please access that Q&A text box and submit your request. And our call-in users may dial *3 to raise your hand. And seeing no requests, I will close the panel.
Thank you. We will now move on to agenda item 12B, general anesthesia and conscious sedation permit evaluation statistic. Ms. Jessica Only, the anesthesia unit manager, please present this item for us.
Thank you, Dr. Felsenfeld, and good morning, members of the board. My name is Jessica Only, anesthesia unit manager, and I will be presenting agenda item 12B, general anesthesia and conscious sedation permit evaluation statistics, which are found on page 127 of your meeting materials. This agenda item includes charts and tables which break down the results of on-site inspections and evaluations completed in the first 2 quarters of fiscal year 2021-2022, which are separated by permit type and end with a breakdown of the current evaluator pool by Northern and Southern California regions. No action is requested on this report, as data provided is informational, and I'm available to answer any questions. Thank you.
Thank you. Are there any board member comments or questions for Ms. Only on this report? Please raise your hand if you have one. I see none at this time. Are there any public comments? Will the DCA moderator please facilitate the lines for public comment?
This is the moderator. Our Q&A panel is again open. Please access the Q&A box and type comment into the text field if you'd like to make a comment. For our call-in users, you may dial *3 to raise your hand. And seeing no requests, I will close the panel.
Thank you. We will now move on to agenda item number 13, an update on pending regulatory packages. We're going to ask Ms. Wallace, our interim executive officer, to lead the discussion on this item. Ms. Wallace, please.
Thank you, President Felsenfeld. In your packet, I've provided a matrix of the regulatory packages that we are currently working on. I'm pleased to report that the board has new regulatory legal counsel assignment. Ms. Christy Shields is our new reg counsel, and we've been working closely over the last month or so to get our packages on track to move them along. Also, David Rugman did start last week. He's our new legislative and regulatory specialist who will be working closely with Christy and I on these regulatory packages. Just a couple of quick updates. The Diversion Evaluation Committee membership package was accepted by OAL, and that became effective on October 1st. That eliminated the term limits for the DEC members. The dentistry law and ethics examination was submitted to OAL, and we're going to be discussing that momentarily. We do need to do some modified text. The continuing education units rulemaking was also published by OAL, and we're going to be discussing that package here shortly. The telehealth, dental assisting, radiographic decision-making, elective facial cosmetic surgery permit, mobile and portable dental permits, and the minimum standards for infection control are all being worked on by David, Christy, and myself. And that leaves our SB 501 anesthesia and sedation requirements, which were approved by the board at the November meeting. That package was submitted to OAL for publication. The 45-day public comment period began on Friday, December 31st, and that ends on Tuesday, February 15th. We have received requests for a public hearing, and staff have scheduled a public hearing to be held next Wednesday, February 16th via WebEx. It is a staff-driven hearing in which we will accept public testimony in response to the proposal. The board has also scheduled a special board meeting on Monday, March 14th to consider the comments that we received during the public comment period for SB 501 rulemaking. We do expect that this rulemaking will require modified text, and to expedite the review process, we're holding the special meeting on March 14th. At this point, that concludes my report, and I'd be happy to answer any questions.
Thank you, Ms. Wallace. Are there any board member comments or questions on this report on the regulatory packages? Please raise your hand. Again, I'm seeing no requests for to speak, so we will move on to public comments. DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on any of the reg packages mentioned in this update, please click on the Q&A icon on your screen, type comment into the text field, and submit that to the host or panelists. And for any call-in users, you may dial *3 to raise your hand. Our first comment comes from Paula Lee. Paula, I've sent the request to unmute your microphone. And as a reminder, you'll have 2 minutes.
This is Paula Lee, and can you explain a little bit about the mobile and portable dental unit registration requirements?
Hi, Paula. This is Sarah Wallace. I'd be happy to walk through that with you if you want to contact me. This is a report on the update on pending rulemaking packages. The board had previously approved language, and at this point, board staff are working with legal counsel to develop the necessary documents to submit to OAL to publish. My email address should be available. Actually, it's sarah.wallace@dca.ca.gov. Please feel free to reach out to me, and I'd be happy to help you.
Thank you. And not seeing any additional requests, I will close the panel.
All right, thank you very much. We will now move on to agenda item 14A and B, which is discussion and possible action to consider A, comments received during the 45-day public comment period relative to amendments to CCR Title 16, Sections 1016 and 17, and adoption of CCR Title 16, Section 1016.2 for continuing education, and B, agenda item 14B, adoption of amendments CCR Title 16, Sections 1016 and 17, and adoption of CCR Title 16, Section 1016.2 for continuing education. Ms. Olney, you're back. Come and talk to us.
Thank you again, Dr. Felsenfeld. And again, good morning to the members of the board. My name is Jessica Only, Anesthesia Unit Manager, and I'll be presenting agenda item 14A and B, which begin on page 138 of your meeting materials. To provide a brief background on the initial rulemaking documents, the initial rulemaking documents were submitted to the Office of Administrative Law for publication on November 12, 2021, which initiated a 45-day comment period on the proposed regulations. Board staff did receive 2 comments related to the rulemaking during this time. A summary of the comments and staff proposed responses are included and begin on page 141 of your meeting materials. Board staff have considered the comments and recommended no revisions to be made based on those comments received. Board staff have identified changes needed to clarify the proposed language, which are highlighted on page 139 of your meeting materials. These changes include clarifying language on when an infection control or dental practice act course provider would be required to resubmit course content for review according to section 1016E1, and changes to section 1016.2 to clarify the basic life support course requirement to include dental assistants, registered dental assistants, orthodontic assistants, dental sedation assistants, and related sections. Board staff recommends that the board consider the proposed motion, which is to approve the proposed amended regulatory text for sections 1016, 1016.2, and 1017, approve the responses drafted to address public comments received during the 45-day comment period on the board's proposed regulation amending required continuing education, and direct staff to take all steps necessary to complete the rulemaking process, including sending out the modified text with these changes for an additional 15-day comment period. If after the 15-day public comment period no adverse comments are received, authorize the executive officer to make any non-substantive changes to the proposed regulation and adopt the proposed regulations as described in the modified text notice for Title 16, Sections 1016, 1016.2, and 1017. Thank you.
Thank you, Ms. Only. Is there any board discussion or questions on this issue? Please raise your hands. I see none. Okay, we will need a motion to do the entire, if you look at page 140 of your meeting materials, the motion language is on the top of page 3 of 3 right there. I'm not going to read the entire thing to you, but I'm going to ask the secretary to read it for the record relative to what you're actually voting on. But if you will look at that, that is what the motion needs to be about. And I see Dr. Chan and Dr. Morrow. Dr. Chan?
I'd like to move the motion.
As written in the material, I assume, Dr. Chan?
Yes.
Thank you, sir. Dr. Morrow?
I second the motion.
Thank you. Is there any further board discussion on that? We have a motion. In this case, is there any public discussion of this? DCA moderator, please facilitate the public comments.
This is the moderator. We've opened that Q&A panel. If you'd like to comment on the motion before you, please click on that Q&A icon on the screen, type comment into the text field, and submit that. And for our call-in users, you may dial *3 to raise your hand. Okay, and seeing no requests, I will close the panel.
Thank you. Board Secretary, we're going to ask you to call the roll and record the votes for this item, but I would ask you to read the motion in its entirety for the record so that everyone's vote is recorded for the specific motion.
Okay, so the proposed motion language says approve the proposed amended regulatory text for section 1016, 1000.2, and 1017. Approve the responses drafted to address public comments received during the 45-day comment period on the board's proposed regulation amending required continuing education, and direct staff to take all steps necessary to complete the rulemaking process, including sending out the modified text with these changes for an additional 15-day comment period. If after the 15-day public comment period, no adverse comments are received, authorize the executive officer to make any non-substantive changes to the proposed regulation and adopt the proposed regulations as described in the modified text notice for Title 16 CCR sections 1016, 1016.2 and 1017.
All right, thank you, Dr. Molina. In your first part of it, you put in 1016, then you said 1000 and something, and then 1017. I assume that the second number in there was 1016.2. Is that correct?
Correct.
Okay, thank you. You are ready to vote. Please take the vote now.
Chan?
Chan, aye.
Chan, aye. Fessenfeld?
Felsenfeld, aye.
Fessenfeld, aye. Larin?
Larin, aye.
Larin, aye. Mackenzie?
Mackenzie, yes.
Mackenzie, aye. Medina?
Medina, aye.
Medina, aye. Mendoza?
Mendoza, aye.
Mendoza, aye. Molina, aye. Montel?
Montel, aye.
Montel, aye. Moro?
Morrow, aye.
Moro, aye. Olagi?
Olagi, aye.
Olagi, aye. Pacheco?
Pacheco, aye.
Pacheco, aye. You?
You, aye.
You, aye. Motion passes.
Thank you, Dr. Molina. Let me go down to where we are now. We are looking at agenda item number 15, I believe. Let me see. Yes, item number 15, which is the discussion and consideration of the proposed regulation to amend CCR Title 16, Section 1031, related to the California Dentistry Law and Ethics exam. Ms. Wallace, would you present this for us?
Yes, thank you, President Felsenfeld. In the February 2019 meeting, the board had approved regulatory language to amend California Code of Regulations, Title 16, Section 1031, relating to the passing score of the California Dentistry Law and Ethics examination. This was to allow the DCA Office of Professional Examination Services the ability to use criterion reference passing scores to make the board's examination legally defensible. At the August 2020 meeting, the board approved the revised regulatory language, and the final rulemaking was submitted to the Office of Administrative Law on December 7th, 2021. On January 1st of 2022, I was contacted by OAL to advise us of a clarity issue with the board's rulemaking text. The initial statement of reasons had referenced the board would be utilizing the modified Angoff methodology. However, the proposed language did not specify that methodology when defining the term criterion reference passing score. After consulting with Board Regulatory Counsel and conferring with the OAL reviewing attorney, we recommend that the definition contained in subdivision C be amended to define criterion reference passing score as, quote, a passing score for the examination established by the modified Angoff standard setting method. This method includes the use of licensees representing the practice of dentistry and a test development specialist, and determines through evaluation and rating of each exam question that the passing score represents entry-level competence to practice in the profession as specified in subsections A and B. We've attached the modified text to the board's consideration in the meeting materials. At this point, staff recommends the board consider and approve this modified text to address OAL's concerns regarding clarity. Board staff are asking for an action to approve the proposed amended regulatory text for Section 1031 and direct staff to take all steps necessary to complete the rulemaking process, including sending out the modified text with these changes for an additional 15-day public comment period. If after the 15-day public comment period no adverse comments are received, authorize the executive officer to make any non-substantive changes to the proposed regulation and adopt the proposed regulations as described in the modified text notice for Title 16, California Code of Regulations, Section 1031.
Thank you, Ms. Wallace. Is there any board comment or questions on this particular motion? Not motion, excuse me, this particular subject. Dr. Chan.
I'd like to move the proposed motion as written.
Thank you, Dr. Chan. Do we have a second? And Ms. Pacheco.
Second.
Thank you, ma'am. All right. Is there any public comment on facility? DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've opened that Q&A panel. If you'd like to comment on this motion, please click on the Q&A icon on your screen. Type comment into the text field and submit that for your request. For our call-in users, you may dial *3 to raise your hand. And seeing no requests, I will close the panel.
Thank you very much. Board Secretary, once again, I apologize. I'm going to ask you to read the entire motion in as it's written there, just for the record, because that's what's going to be voted on. Would you do that, please? And then call the roll for the vote.
Okay. The proposed motion language, approve the proposed amended regulatory text for section 1031 and direct staff to take all steps necessary to complete the rulemaking process, including sending out the modified text with these changes for an additional 15-day comment period. If after the 15-day public comment period, no adverse comments are received, authorize the executive officer to make any non-substantive changes to the proposed regulation and adopt the proposed regulations as described in the modified text notice for Title 16 CCR, Section 1031.
Please call the
take the vote. Chan?
Chan, aye.
Chan, aye. Fessenfeld?
Felsenfeld, aye.
Fessenfeld, aye. Larin?
Larin, aye.
Larin, aye. Mackenzie?
Mackenzie, yes.
Mackenzie, aye. Medina?
Medina, aye.
Medina, aye. Mendoza?
Mendoza, aye.
Mendoza, aye. Molina, aye. Montel?
Montel, aye.
Montel, aye. Morrow?
Morrow, aye.
Morrow, aye. Olagi?
Olagi, aye.
Olagi, aye. Pacheco?
Pacheco, aye.
Pacheco, aye. You?
You, aye.
You, aye. Motion passes.
Thank you. This concludes the open session portion of this meeting for Thursday, February 10th, 2022. There are no closed session items to include, I should say, for today. Therefore, this meeting is recessed until tomorrow morning, Friday, February 11th, 2022 at 9 a.m. Thank you, moderator. Thank you, board members, and we will see you all tomorrow. Have a good afternoon.